Hi, everyone. It's Cricket Barrientos, founder Sounds of Autism. I'm here today with Spectrum Talks and Tips International and our co-host, Dr. Anila Khan, clinical psychologist, psychotherapist, speech therapy. Oh my gosh, she does so much. She's all the way in Pakistan, so she is 12-hour difference from us. She's in the nighttime, we're in the daytime. Hi, Dr. Khan, how are you?
I'm good. How are you? Can you see the screen? I'm sharing this.
Yes, I can see you. And now you're showing, yes, now you're sharing. So Dr. Khan has some awesome things she'd like to share today about developmental milestones and the red flags that parents should be looking for.
Yeah.
We both agree that to educate people, right, Dr. Khan, that we need to educate people so that they know what they're looking for and at, so that we don't miss the milestones and realize that our children may be struggling with something. So I'm going to turn it over to Dr. Khan and she will be presenting. Thank you.
So you're very much right that the reason, you could say the main reason of doing all these sessions, all these discussions, is that so that we let other people know that if they start noticing these signs, so they go to the therapist, go to the doctor on time. So they work on early intervention, and we all know that early intervention help a lot in children to bridge the gap between that. So today we are going to talk about developmental milestone, and that will be journal developmental milestone. That's not like the new pediatric list that just came recently. These are journal milestones, and everybody can see these changes or differences among other children in their home. And if you are confused among that thing, then start comparing. I just usually don't ask people to, and I'm against it to compare your child with other children. But when you talk about developmental milestone and when you talk about these things, then you need to see your child, so that you need to get the idea where your child is and where what are the lacking of your child. So let's talk about. Okay, so developmental milestones are basically physical and behavioral sign of development. Actually, development mean I mean growth, I mean intellectual growth, cognitive growth, language growth, physical growth, and we observe it in infant and children, like rolling over, crawling, walking, even eating, sucking, chewing, babbling, cooing. These all are developmental signs, developmental milestone, and it has an age. For example, if a child is of 1 year of age, then he have to do, and he have to do these things. If the child is not doing these things, then you need to start looking into that thing. Not in the sense that you get a lot of suspicious what is happening with my child, but even then you need to start studying these things, that either your child have problem or not, so that you prevent a lot of issues or you go toward early intervention. So we consider these as developmental milestone. And why it's important, because if a child don't meet that criteria, then failure to reach the milestone could indicate some developmental disorder or genetic condition as well. Developmental disorder could be, for example, it could be autism, like autism and neurodevelopmental disorder, and it could be genetic disorder, just like intellectual disability, cerebral palsy. There are a lot of disorders that we can, if we start working them on early, then we can prevent a lot of things. I am specifically over here talking about physical, physical disorder, in a sense like cerebral palsy. In cerebral palsy, if you don't start working on the child, and the child start, their muscles start getting maturing, and start get the stiffness is coming in the muscle. So it is the whole life dependency on the caretaker. So we have to consider these facts also. So, but you need to consider that you don't need to get very suspicious or very alarmed that, oh, my child is doing this. 2 or 3 months could be, we could give a margin to a child. But if a child is 1.5 year old and the child is not saying a word, that it means that you have to start considering the fact, if the child is not giving you eye contact, or the child is not looking toward you when you're talking, or the child is not, when he saw you moving, he's looking toward you. So it means that you need to start considering different thing, and you need to start working on at home with the children. Don't just wait for that you have to go for a formal diagnosis for that thing, either it's a problem or not problem. But I think as one consultation would let you know that your child have these kind of issue. So start working at home on these things, like we are sharing a lot of presentation time to time, a lot of trainings time to time, and you can do these activities. But today we thought that why not give insight to the people. So slightly different, like I told you, it could be we can give some margin, like 2-3 months we can give some margin. But sometimes even this is happening that few children skip some milestone. For example, few children sit and they don't walk, rather they start, they don't crawl, rather they start walking. Like they're very physically active. For example, if you talk about ADHD, in some cases they are very active. If you talk about autistic children, sometimes they are very active. I mean, they have issue in the they are lacking in the language area. But the point over here is, in autism, children have language in the start. That is the point. People don't get what happened to that child, why the language is gone. Because till the moment the child reaches at 3 age, that is a full-blown episode of autism, and child start getting back in a lot of things, especially in the language thing. So that's why people are still looking for the ways why the things are different, what is happening with the child. So even then, if you talk about autism or if you talk about ASD, so sometimes the point over here is that sometimes the child would skip something, but it doesn't mean that the child is lacking over here because he reached to the other milestone. It means that the child is more active, and the child is more capable of doing more physical things, or we could be very active. So why not explore some physical activity with the children? Like, it's a good indicator that it could be a sportsman, an active child. So today, the area that we are talking about is language and communication. Language includes speech, communication, and that start from the sounds. Okay, if we ever try to understand that why the child is not talking, start working from the sound, because when we are children, then we start from the sounds. Cognitive include thinking, reasoning, problem solving, and understanding. Motor coordination, like I already wrote about cerebral palsy, that is a motor coordination kind of disorder. In that, the child is not able to, the child fine motor skills are poor, gross motor skill are poor, even child cannot walk, child cannot sit on the time. Gross and my, for example, jumping, hopping, throwing, catching, drawing, sketching. These are motor coordination milestone. Social interaction, in the initiating with the pair, either the child is playing with the child or not, the child is actively participating in group or not, or the child is sitting alone with their own toy and just doing, involving echolili and things like that. And adaptive is very important. Adaptive dressing, eating, and watching. According to the researches that on intellectual disability, sometimes we have seen that a child IQ is on average, but they are in a good hand, or you could say parents or therapists work on the child so well that the child adaptive skills are so good. Like the child understand how to eat independently, how to work independently, how to walk independently, how to go to the washroom, how to eat something, how to warm something in the let's say oven, and things like that. So over here, that is the environmental factor, and over here the role of the therapist and the parents come here. And few parents are very good in making their child adaptable, because it doesn't matter that the child have a disability. If the child adaptive skills are good, then he can survive in any situation. So let's see that if we okay, so let's discuss journal list, because I already told you that that is not a pediatric list, that is not absolute list, or these are just general thing that we are going to start about from infant to child 18 years of age, and let's see what are different things that we have to see. If a child is infant to birth, for example, the moment the child open his eyes, and even I would like to mention over here, you need to understand that the child cried or not. First cry is very important. First cry means that if the child don't cry, it means that the child lacks oxygen. And if the child don't cry, it means that he have to go to the ventilator. And if this thing don't happen on immediate, if immediate action is not taken over there, the oxygen, just because of oxygen shortage, the brain remains small. So it could lead to intellectual disability. It's a very important thing that the child cry or not. Or sometimes it's also called blue baby syndrome, because lack of oxygen at the time of birth. Okay. When the child is still 1 year, the child is able to drink from a cup, able to sit alone without support, babble, display social smile, means if mother or other person is looking toward the child smile back. Display social smile, like gets first teeth and play peekaboo, like they know how to play, they're playful, they start giggling, smiling when they look toward you, roll over by themselves, like they can hold their neck, they can walk, they can crawl by themselves. Say mama and dada using term appropriately. And over here, you need to see that the word means actually what they are trying to say. For example, mama is not for everything, mama is for mama. Dada is not for everything, papa is not for everything, papa means papa. So they are using that word appropriately. It means that they recognize their parents, they recognize their mother, they recognize their father. and understand no and will stop activity in response. So it means that when you ask child to stop doing something, then the child will stop doing that thing. And it's not like that. If we see in the children who have like developmental delays or who are self-indulgent children, like some children are on spectrum, they're involved in their own activity, like they're not paying attention, or they're too much absorbed in something that their all senses stop working actually. That's the reason they are not responding to you. So you have to bring them back to the and I have seen a lot of parents who, when the child is inattentive, the child might have ADHD or autistic or some other reason, or the child go for a lot of, even they go for brain scanning, they go for a vision test, they go for hearing test, and all tests came normal, and they say why the child is not responding. So that is the thing, that they have different aspect, because if we go into the disorder, then it would be a long debate. But the point over here is that the child would listen to you, walk while holding furniture or other support. And few children are so good in the sense they are good nourished, or they are well well managed by the caretaker, by the parents, so they can even start walking by themselves also. Okay, so if you talk about toddlers from 1 year to 3 year, in the age, the child's able to feed themselves neatly with minimal spilling, like they don't spill the things on the floor, they will not take out food from their mouth, and they will not throw things or not spit the food, like they would know that we have to eat. It means that, because when we talk about developmental, then a very important thing, that those children who have are delayed, they have poor body tone. Poor body tone means their muscular tone is low. They cannot do some physical activity, like you remember in one discussion we talk about working on oral motor area. So it's the same thing. So if they have issue in the oral motor area, means they cannot chew also. So if we start working on the exercises for the speech therapy exercises, so it is also adding into their chewing activity. So when they will start chewing, then they will get nourishment back, and they will gain they will they will gain a good health. Next thing, at that age, the child could draw a line, run and walk backward, forward, like even they can walk on the stair also. Begin paddling cycle, and I have seen a lot of children who cannot do that, but with the passage of the child start doing that. Can name pictures of common object and point body parts. They know themselves and the point body part. Dress themselves sometime, like they're trying to wear shoes. It doesn't matter that they are wearing it wrong, but even then they are trying. Maybe you might see them taking their mother things and stuff, but their mother is wearing. So over here it's a thing. Learn to share toys without adult direction, and learn to take turns if directed while playing with other children. Like somehow the child is know the concept of turn taking. The child knows some social rule, and the child master walking recognize and label colors, like they have some basic vocabulary. They know male and female, but and don't like what is boy and what is girl. Somehow they get this idea at this age. And they can also use spoon and feed themselves, and they can also follow simple command. It means that their fine motor skills are very good, that they can feed themselves. Sometimes this. So let's talk about preschooler from 3 year to 6 year. When the child is at that age, they're able to draw a circle and square, able to draw stick figure and 2 and 3 features of the people. I'm telling these things because if the child is not able to do these things, then the child is if the child is not intellectually disabled, then the child might fall in the criteria of learning disabilities and learning difficulties. So these things are important. That's because that is the age when we send our children to the school. The child can balance themselves. The child is able to skip, may begin to ride a bicycle, begin to recognize written words, reading and writing skill also came in that time period. Catch and bounce the ball, play complex games, and doing a lot of things independently without any help. Enjoy rhymes, word playing, hops and 1 foot. Like I'm saying, it's a playful age, and the child start playing with themselves and also with a group of people. Also, it means that the child starts socializing and also understand the concept, the size, the numbers, and it's more like about the learning starts over here now, the academic thing, or the child start knowing the word actually, and the child knows the concept of size, and the child also knows the concept of the time, like it's day and night. And let's talk about school age from 6 to 12 years of age. When the child is at this age, the child begin to gain skill for team sports, suppose soccer, t-ball, and other team sports. Child begin to lose baby teeth also, and the teeth, new teeth are coming, and that is permanent. The girl begin to show growth in armpit. It means that the secondary sexual characters are trying to, coming in that time period. And development of body parts, the girls, it's about cycle in the girls, and peer recognition began to become important, and they know the concept of grouping, and they get the idea that grouping is very important, and they have to play in a group. Like they are making, it's basically, you know, in our when we were studying psychology, they used to call it gang. They start making gang, actually, you know, the small gangs. We know about the bigger gang, but it actually starts from the school. So the small gangs are becoming out, and you might have seen the way they're exerting their power, and few of them are also starting bullying. So that's coming from their side. And definitely these children learn that from the external environment, from, you know, maybe watching from the movies, watching on the street. So they are what the things they're watching elsewhere, they're applying that skill to their own life now. Reading skill are further developed. Routine is very important. Day activity, child active, child have activity, child has things to do. Like in the morning, he will do certain. In the evening, the child will do other things. And the child also can. The child is also able to follow different and difficult things, and the child know the abstract concept. Okay, let me tell you what are the abstract concepts. Abstract concept are, you are trying to know something that is not present actually. So this is the time when child start getting the social norms, you could say, the society rules at that time. So at that age, the child could understand. Before that, it's difficult for the child to understand because he's so much involved in themselves and so much involved in their family. So the moment the school institution came, so the things become different for the children. Now let's talk about adults 12 and 18 years of age. That's a very crucial time period. At that period, children are involved in a lot of risk-taking, behaviors. For example, it could be gang. The child could involve in drug also. The child could involve in other bad behaviors also. And child are doing just to impress their peers actually. So, for example, they will start smoking because other person is smoking, and smoking maybe seems some kind of a cool thing, or maybe bullying seems something kind of a cool thing. See what I did with that person. I'm that powerful. I can do something. I can do that thing. So that is a time where, which is crucial. And at that period, because this is a puberty stage also, so children are very aggressive at this age. And it's very difficult to work along with them. And there are a lot of fight of these children with their parents. So that is the age. And that's actually the hormones, the puberty stage, so that is playing role. So sometimes parents are thinking that's our fault, our children are doing things, and children are saying the parent did not did something for us. But even they don't get this idea that their parent did a lot for them already. Now it's their time to make their life and get education. So if they're not getting education, that's not their parent fault. It's up to them to get that education. The parents provide them all the facilities which they have. So at that time, adult height, weight, and sexual maturity also came. Boys show growth of armpit. Well, these are secondary characteristics, and their sexual parts are also emerged, and girls show growth as well. So these are basically, point over here is that at that age, sometimes people don't get these things, and sometimes mothers are also worried about their children that either they will get or they will get these characteristics or not. But if they are not getting these things on time, then it means that you have to consult someone about these things, because that is alarming kind of thing. That is a kind of medical emergency. Then peer acceptance and recognition is also there. Like I already told you, that gangs are now bigger gangs. They're showing a lot of things. They're involving in a lot of risk-taking behavior. That also include one wheeling and stuff like that. And understand the abstract. Now their thinking is more mature now, and now they can understand that whatever they are doing, they have to be responsible for that thing. Bye. It's playing a little bit funny, like my PowerPoint. Okay, so now let's talk about signs of developmental delays. So according to like units of new definition, the child is still 18 of years of age. So what could be developmental if, or you could say, let's just discuss the sign that could be the developmental delay, and if this sign, a mother finds this sign, and she need to look into some professional help on time, so that she prevent a lot of difficulties of their child life. And like we discussed the developmental milestone, and you might get the idea that these are tough things, difficult things, challenging things. A child need to master these things. But if a child is with some kind of disability, some kind of delays, the child is on with some kind of with some label, the child is already with some label, so these things get difficult for the child. So the early we know about these things, the early we can prevent a lot of things. But it doesn't mean that if at moment you cannot do anything now. If you are late, it doesn't mean that you cannot work on your child. You can still work on your child. But instead of getting guilty that you did not knew this before, I would say that start working on present moment. You can do a lot of things for your child even presently. So you just don't take the guilt of that thing. So developmental delays refers to when a child has not reached to developmental milestone expected of the children age. Delays may occur in motor functions, speech, hearing, and vision also. So let's say what could be cognitive delays means the infant can affect in infant it can affect the awareness of intellectual functioning, potentially causing learning disabilities that become more apparent when the child goes to school. And sometimes this happens that you see that a child is a very obedient child. The child is a very the child is shy or timid child, and he's not saying no to you. And I would say that if a child is not asking you a question, it means that there is something you need to look into. By that I means that why the child is not able to get the difficulty, the difference in few things, like the difference between some concept, big and small. And if the child is not aware of these things, the child could get difficulty in the school. So these are cognitive, and it means that intellectual functioning may be slow. Maybe the child needs extra time for that thing. So one thing is cognitive delay. The other thing is physical development, and let's talk about this age wise. Okay. So first I'm going to talk about 3 and 5 months. If a child is of 3 and 5, physical means that the child is able to move their hands or not, grab something or not, hold something, take a glass of water or not. So these are physical milestones which we call fine motor skill. If a child is at 3 and 5 years of month, if the child does not put object in their mouth, I mean, sometimes we are preventing our children just because of, we have germ phobic, that it is going to create some issue for the child. The child might get, leaky gut and stuff like that. The child could get food poisoning, but we don't get this idea that the child is mastering a skill. If a child is throwing something, I mean, like throwing things from the floor, from the bed to the floor, it means that the child, discover the gravity. So that is a good thing. If child is putting something in their mouth, it means that the child is functional in physical development area. Poor head and neck control, the child cannot hold their control, and you might see that if you hold children like that, then they will go back, and they fail to reach to grasp the object, and they're not able to get something. They have to, I mean, you might see that their body tone is so low that they cannot even move their body, they cannot move their head, or they cannot reach the object and hold that object. Okay, when the child is of 7 months, cannot sit up without a support, does not roll in both direction, muscle spasm, muscle stiffness. Like I told you earlier when I was talking about cerebral palsy, that if you feel that a child is having this kind of condition, and you start working on child in early stages, then that is very helpful. Because if you talk about muscles are like that, you have to make a muscular memory for that. If you will make a muscular memory, then it will transfer into sensory memory, in the sense then it will transfer into your brain. And that's why we are doing things in repetitive manner, so that the child that thing become automatic in the child mind. So floppiness, and does not bear weight on their legs when they pull them out, snatching position, standing position, and difficult swallowing. Like I told you earlier, that's why that everything is related. If child muscular tone is low, it means that the child is not able to talk. The talk will be also delayed. When the child is of 1 year age, does not fall, limping or awkward body, or you would see that the child body is not in the balance, cannot stand with support, even if there's a support, and even then the child cannot support properly, and there's a lot of accident, like falling accident about that children. And if the child is of 2 years of age, cannot push or wheel toy, means a small car, the child cannot push that part, cannot walk, walk only when walk only with their toes, or with the support, and speech delays. So let's see speech or language delay. When the child is of 3 or 4 months of age, does not respond to loud noises, does not babble, does not coo. Even cooing and babbling is not the sound. Ooh, it's sounds like that. begin babbling does not try to imitate sound. Like you have seen the child are sometimes start imitating sounds, or even the child learn different sound from the environment. So what the child is saying, there's some sound, even they're talking in baby language. So even then it's indicated that the child is developing, and the child have that language, but it doesn't mean that the word should be proper. It could be any sound, it could be meaningless also. When the child of 7 months does not but if the child have issue, then he will not do these things. He will not imitate the sound. He will not say anything, and he will not even repeat the sound. And when the child of 1 year age does not use single words such as mama, does not understand instructions such as no, yes, bye, like we call it one-step instruction. So it means that child don't have vocabulary for these things. So the child is not able to respond to these things. Even the child don't have a word. So if the child don't have sounds, he's not going a babbling, it means the child don't have words. So when the child reaches to 2 years of age, he cannot speak, or he have very little vocabulary, less than 15 words. Does not use two-word phrase like give me. This is a two-phrase sentence. That's two. It's a sentence, and only imitates speech. Even sometimes you would say that the child is, like talking Tom, like you're saying something, child is repeating it back, and they don't get this idea what it actually means, because they cannot comprehend that thing. And does not use word to communicate more than immediate need. And they don't communicate. They will only communicate when it's required. For example, they will not say anything, but when they are hungry or thirsty, then they will say or talk something. Okay, let's talk about social and emotional development. When a child of 3 months then does not smile at people, and does not pay attention when somebody's talking, and to new faces, or seems frightened by them. Like the child has stranger anxiety, and the child will start crying the moment he will feel discomfort, because the child don't have emotional connection with someone. The child is not relying on someone, and he don't know, or you don't feel connected actually with the family members, or the caretaker. So the child will start crying the moment a new person entering the room. Even the child will cry in the hand with the mother also. When the child is 7 months hesitate to cuddle, show no enjoyment being around people, means the child don't want to play with someone. They don't enjoy when they're around people. Cannot be comforted at night, like after 5 months. It means that sleep issues. Does not smile without prompting by 5 months. Like you have to ask to smile. The child don't smile at their own. Even you have seen that children are even smiling in their sleep also. So it's a kind of a reflex a person have it. So if the child is not doing that thing, it means that the child is not no emotional. The child is emotional delay or social delay also. And a child show no affection toward parents and caretaker. And that is a point when mother or father say that the child is not recognizing us. The child recognize them, but the child is not emotionally attached to the parents, or don't feel that attachment. Or it means that the way of affection and attachment is different, which is different from the other population. So that's the reason that they don't listen to their mother, or they don't talk to mother. You would say that they don't feel comfortable around their mother. They want to stay alone and want to play their own thing. And when the child is 1 year, they do not indulge in back and forth sharing of sound. Like it's called reciprocal communication. For example, we have to talk to each other. Like you're talking, I'm talking, and we have to talk simultaneously to initiate a conversation. That's how social communication is. Does not indulge in back and forth gestures such as waving, reaching out, and pointing. So if you say hello, so I have to say hello. If you say bye to, I have to say, because it means that these are our social cues which we have to develop, or which we develop with the passage of time, and which we have to follow to live in a social construct. So when the child is not able to do these things, it means that the child is delayed somehow, and the child have to somehow we have to work on different skills. The child. So that's all about today, and I'm sure that was journal, and I think it don't have that kind of difficult language which parent would not understand. So I think that parent would take benefit from that.
I think, Dr. Khan, first of all, great job on that. I think that many parents get so wrapped up in the everyday lives that they live that they forget to pay attention to, especially if they're at home, working, outside of the home, mom and dad, they forget to acknowledge the milestones. So by the time they get home at night and, they've finished their day, they're not seeing the signs, because they're just doing, the everyday stuff, making dinner for their family, and, making sure that their kids get a bath, and all those things that need to happen and the eyeing and all these things, so that you can see if they're not responding to those things, then obviously we need to pay a little more attention. And if they're in a daycare setting, or if they have a babysitter or daycare nanny, or just something to help them, you want to make sure you're communicating with those people as well, because a lot of times, for us development, sensory processing delay. So I encourage families to be aware of those things, especially at the beginning stages, because if you can catch it between 3 and 5 years old, before 3, or no later than 5, that's the ultimate goal, right? Because if you catch it at 3, especially in the state of Arizona, there's a lot of resources that can help you kind of catch them up and help guide you on this journey. But if you don't see it, and let's say you get to school, the teacher, sometimes they're not comfortable sharing that with you. Having that open communication and dialogue is super important, because if you open the door, the teachers will be more willing to share than if they have to bring it to you. People avoid conflict sometimes,
Yeah.
and they don't want to share that information, or maybe they're just told they're not allowed to do that. So anyways, good job. I think it was a very positive way of presenting this, but letting families know if these things are happening to you, you can reach out to Sounds of Autism, Dr. Khan. We can all help you and guide you to the next thing, an evaluation, and sharing this with your medical doctors and your the people that are taking care of your children.
Yeah, and the important thing over
So-
here is that if you don't feel that it is delay, don't think that now it's too late. If you start uh, uh, thinking about that point at this time of it, then you are going to ruin, or you are going to block his whole life for that thing. So the energy that you might put in doing something better for the child, now you're putting that in something negative thinking, and you're going into depression, and the child is going to depression. So the whole family is going to affect because of these things. So don't think that at this age the child is not able to speak and this is not going to happen, this is not going to happen. It's not like that. But we always say that if you're the more aware you are, the more helping you are. And it's not about that, about your own child. If you see somebody in your community, why don't you help them out? Like, why don't you you have that mother to suffer less about that situation. So I think it's a good thing to discuss about these things. And like, remember in the start I said that we have to talk about everything. It's not that people would know, because they are mother they would know everything. It's not about that. I'm sure that they are very educated because they are mother and they know about their children. But giving a different perspective and helping them out to understand their child situation is the best thing we offer. And maybe by giving this information, anybody could take benefit of that. So that's end for today, and see you in the next session.